Hi, I'm Nick Sevdalis. I'm a psychologist by training. I'm a professor at the National University of Singapore and the academic director of the Center for Behavioural and Implementation Science Interventions. I'm also the academic director of the Master in Science in Behavioural and Implementation Sciences in Health.
My name is Yong. I'm an economist. I work in the areas of health, finance, social care. I'm an interdisciplinary researcher with a real interest in how impact is made in the world.
My name is Tiki Pang. I'm a visiting professor at the Yong School of Medicine. My own background is in microbiology, infectious diseases. I work for the World Health Organization, particularly in the area of evidence and information for policies.
As I was trying to study and improve healthcare processes in the context of surgical care or cancer care, I was getting, alongside my colleagues, increasingly frustrated that all the interventions that we're evaluating and producing were not routinely implemented, even in the hospital systems which were employing us at the time.
There's a lot of evidence that says it takes sometimes between 15 to 20 years before a product or an innovation actually gets used in delivery of healthcare.
There are reasons at many levels for why we don't see that change happen. We have individual biases, sometimes explicit biases that we're aware of, but sometimes also biases that we're not aware of. But we also have systematic barriers that prevent change from happening. Some of these are visible, some of these are less visible.
What implementation scientists do is they study the process of implementation. We do that via observing what people do. We analyze that systematically. We try and find what stops people from implementing a novel intervention or a novel pathway or a novel device.
It's not enough for us to have research. It's not enough for us to have scientific evidence. If that evidence doesn't make it to the bedside, it doesn't make it into the healthcare system.
So the value of BIS, if you like, Behavioral Implementation Science, is in addressing that very last step in the whole sequence of how science and research can improve health.
BISI is the first center that aims to bring together healthcare scientists who study implementation processes and behavior change in the context of healthcare. We wish to offer research, education, capacity development, and networking. We wish to be a place where people are coming together to discuss and debate and exchange ideas about what priorities we have to study in Singapore, but also more widely in Southeast Asia and beyond.
A healthcare professional who understands behavioral and implementation science will be able to better assess needs on the ground, to understand the complex circumstances in which they're working, to better design programs that work for their patients as well as their peers, and to think about how we evaluate those programs in a way that is rigorous, systematic, and helps the system to further change for the better.
Our master's program in Behavioural Implementation Sciences in Health is our flagship program that aims to deliver this high level of capacity development. It's a program that covers introductory, intermediate, but also advanced aspects of implementation behavioural science methodologies in the context of health and healthcare.
What we'll be giving you is a toolkit that includes both qualitative and quantitative methods and a combined lens for thinking about how to do this in a practical and effective way on the ground.
We very much look forward to welcoming you to our master program, to the National University of Singapore and to Singapore itself. You'll have a wonderful time. You'll be challenged intellectually and academically. You will learn a whole lot of new things, and you're going to have a lot of fun doing so.
Hi everyone. Welcome to the second info session for the Masters of Science in Behavioural and Implementation Sciences in Health program, or you can call it MScBIS for short. So I'm Olivia, a member of the admin team for the Masters program, and I'll be your host and moderator for today's session. So first and foremost, thank you all for taking the time to join us. This year, we welcome our very first cohort of students, and the upcoming August 2025 intake will be our second. So on behalf of everyone involved in the program, we appreciate your interest and look forward to sharing more about the program with you over the next roughly 1.5 hours. With that, let's kickstart today's info session with Professor Nick Sevdalis, who is the Academic Director for BC and our Master's program, and he'll provide you with an introduction of the Behavioural and Implementation Sciences. So over to you, Nick.
Wonderful. Thank you for the introduction, Olivia. And thank you to those of you who are joining us tonight for this second info session. We've done the first one in December. We have a few more coming. So delighted to be sharing the sort of the rationale, the setup, and the practical aspects of how you get onto the MSc program, what it looks like in terms of content. And indeed, tonight we'll also have one of our students, the current students of the program, so you can find out a bit more about what it feels like to be on the program from someone who's currently on it. So I think you've already seen me on the video. I've got a couple of slides to introduce what I'm sure you've already have searched and looked at. What is it that we refer to when we refer to the science of implementation, the science of sort of human and organizational behavior, which I've got on the next couple of slides. So essentially, what you'll see on my next slides, Olivia, is that we take a fairly broad view of what behavioral science is. So behavioral science is psychology, but not just psychology. We look at any sciences that look at what happens inside our brains: cognitive science, psychological science, social sciences, because humans, as we all know, we're social animals. So we look at theories, we look at empirical data to try and work out how we formulate judgments, how we move from making judgments to decisions. So we do that for healthcare providers, healthcare funders and managers, and also the population at large. We want to understand health and health-related behaviors, how people respond to healthcare interventions. And we do this, we want to contextualize this within the context of healthcare systems and organizations. And this is where the science of implementation, which in the last 20 years have been defined as a field in its own right, as the field of implementation science and implementation research, we contextualize individuals' behaviors within the organizations, the teams, or the professions that they work within. So the culture and the organizational framework is often one of the major determinants of human behavior: what we do, what we consider, what we do not do or do not consider. So essentially, what this MSc does, the ambition is articulated on the next slide, that we give you the breadth. We go through the breadth and depth of those sciences. We cover frameworks, methodologies, measurement instruments, so that taken together, the knowledge base and the skills that these fields provide, you're then better able to address burning, significant, current, but also future problems in the context of healthcare planning, healthcare delivery, population health as a whole. So essentially, in the next slide, we've articulated what, again, we all know are some of the major reasons why one would choose to study on our masters. We know that healthcare expenditure is only going up, but we haven't seen it going down in any advanced or even developing healthcare economy around the world. So this is a problem that we have. We need to be able to afford healthcare for the future. We know that we tend to live longer, so we need to look into this. But at the same time, we have resource constraints, we have workforce constraints, so we need to optimize healthcare delivery and population health-related behaviors as best as we can. And we also know that we produce far more research and we have far more knowledge than what we're able to actually implement in a reliable, scalable, sustainable manner. So we need to understand why that is. And this is the problem statement, the exam question, if you like, for this master's program. We do all of this in the context of ever-increasing emphasis on population health and what we can do to prevent people from falling ill in the first place before we start looking at how we're going to intervene to treat them. So all of this has a fairly complex and challenging environment for any healthcare provider or any scientist or any engineer or social scientist or manager who works in the context of healthcare. So essentially, the next slide outlines our ambition, which is that we really want to have a new cadre of people within Singapore, within Southeast Asia, within Asia or beyond, even that, because we do understand that labor markets these days are fairly global. We want to have a new cadre of people in the MSc graduates who can study, they can consult, they can design and intervene to improve, to ameliorate, or to really innovate fairly radically in terms of the design and delivery of healthcare and health systems and health policies. We don't want to have yet another generation of people who produce tons of really good guidance, but we want people who are able to navigate the obstacles and the challenges in getting what this really good guidance suggests into the front line, into the bedside, just to reach the patients, as one of our faculty members, Dr. Joanne Yong, said in the video that you've just seen. My final slide gives you a sense of the global situation at the moment, the state of the art, as it were. You're looking at this before we launched this master's and before we instituted this center at the National University of Singapore. There's a big glaring gap. There are centers for the study of behavioral implementation sciences in health in pretty much every country and continent except Asia. We're the first such center. We're definitely the largest. There's now more groupings appearing in Asia, and this is definitely the first MSc level program, postgraduate level program in these sciences that we're offering. In fact, it's one of the very, very few ones in the world that combine behavioral insights with implementation research. So these are, I'm sure I'm covering ground that you already considered. There's all sorts of reasons why implementation science and implementation scientists and researchers are in demand. Implementation consultants are in demand. You're going to hear more about this when we talk about the employment prospects for and plans for our future graduates. So this is all I had to say to welcome you again to this session, and we're going to move on to the program director for our MSc, Dr. Aoife, who's going to talk to you about what the content of the program is and what the different courses are.
Brilliant. Thanks very much, Nick, for introducing me. Really glad to be here. Really excited to talk to you guys. We've already, as Nick has explained, we're running this cohort already. We've got some classes on at the moment, actually, as it so happens. So it's great to be here. So we're going to take you through a little bit of the learning objectives and a little bit of the course that's involved. And then, of course, we'll take you through an awful lot more in a minute. So the main objectives of the course is to kind of develop knowledge and expertise in behavioural and implementation science as applied to healthcare settings. So this course is mostly applicable to healthcare people, but of course you will learn when you join the course, hopefully, you will learn that you can use it in other areas as well, like pharmaceutical areas, environment and everything else. So implementation science can be applied, and behavioural science, to other areas as well. But this master's is mainly in the healthcare area. That they're the kind of case studies that we'll be looking at as well. You'll also learn how to use state-of-the-art behavioural and organisational change methods in which you can then lead in healthcare organisations in Singapore and further afield. So we'll talk about different kind of methods, from implementation science methods, behavioural methods, organisational change, leadership, programme evaluation, and different things like that you can use in your work if you're a practitioner, but also as a researcher. We have a lot of researchers who have other expertise in other areas who come to learn more about implementation and behavioural science as well. And of course, this is a course that Nick and myself are very involved in, is mastering the methodological and statistical approaches to evaluating implementation and this impact on evidence-based interventions. And for those of you who already work in healthcare or in the research world, evidence-based interventions, you've heard many times before, but of course, this is a big focus for us in implementation and behavioural in this master's. Next slide, please. So the main overview of the master's, it's a 40-unit coursework postgraduate program, and each course is worth 4 units. So each student will have to do 7 core courses, and I will talk a little bit about the main core courses that every student will have to do in a minute. And you also have a choice of 7 other elective courses. We might have some more in the future. 7 other elective courses that you can choose from, and you need to choose 3 of those. So overall, you will need to do 10 courses to make up your 40 units. And some students like to attend some of the other courses because they're really interested as well. So we have a bit of flexibility for that to attend as an observer, but you don't have to do the exam as well. So there is flexibility if you're really stuck deciding which course you're really interested in as well. This is the first hybrid master's program in NUS. So we do have 2 courses that are delivered completely online, and I'll talk a little bit more about those. So they're e-learning courses and they're live, so they're not there. So you are actually talking to course leads as well, and we work through different kind of examples, theories and examples in implementation and behavioural science, and they're completely online, so you can do those from the comfort of your own room. The rest of the courses then are mainly face-to-face, but we do have some flexibility. Sometimes we run them as hybrid, some sessions, or some of them are online as well, if there's certain things coming up. So we do have a bit of flexibility there as well. The main target audience for this master's are people like healthcare professionals, people work in management teams, and policymakers, because we're really targeting that kind of group of individuals. It's also very useful for applied health scientists, behavioural scientists, and implementation scientists as well. So you'll be learning more about this and working in the world and using this kind of knowledge in the future as well. And anyone who's involved in health services or quality improvement projects or anything that wants to work in those kind of ways. So they're for healthcare people who might want to improve a service or want to learn more about that. We'll talk about quality improvement and implementation science as well. So those kind of projects as well, and evaluation as well, which we'll talk a little bit more in a second. And yes, so the maximum, sorry, my screen is frozen. So the maximum, it's 1 year for full-time students. So students who want to complete it can complete it over 1 year, but there is flexibility. So we do have a couple of students who said, okay, I'm a bit tired now, things are going on. So they actually have extended it. So they're doing it over 1.5 years, and some are doing it over 2 years. So there is possibility to do that if you do plan to take it full-time and something happens and you decide to extend it. And for the other students who'd like to do it part-time, who are already working full-time or working or doing other things as well, it will take over 2 years to do it part-time, but you can extend it if you need to a maximum of 4 years. So our next intake is in August in 2025. Jen will talk a little bit more about the applications and everything else in a minute, so I'm not going to go through that, but that's our next intake. So the next semester will be starting for our new students in August 2025. Next slide. So this, as we've said already, this is the first course in NUS to be offered as a hybrid. So we do have some e-learning courses and we have some face-to-face courses, and we do some hybrid courses as well, have a little bit of flexibility for students so that they can, that we do some of them online as well. So this helps with our busy professionals so that they can apply and do this as well. And we're willing to, to work with you and discuss that. So it is useful. So we have a master's project students who are just starting now, and they're a small cohort, and they said, actually, can we do some more of these sessions online? So most of the group, all of the group have agreed to do that. So we're doing that for them as well. Next. Yes, so this is the really exciting thing about this master. It is the only higher education program that combines both behavioural and implementation sciences around the world. So I've been doing this research before. There are some in the UK, but they don't involve behavioural and implementation sciences. There are some in the US as well, but not very many combine the two, behavioural and implementation sciences. And that's what it makes it so exciting. So our team, our faculty are made up of behavioural economists, implementation scientists, other behavioural scientists as well. So it's a big team, and other researchers from other backgrounds like social sciences as well. So it is a really nice cohort of individuals. Next one. And so, yes, students will learn through first-hand experience of our first world panel of experts who are, as I've explained, behavioural and implementation scientists. We do have other researchers who come in who are practitioners themselves and very, very involved in research. So they will come in and talk about their research and their projects that they're working on as well. And students have already connected with them, working with them as supervisors as well, or being more involved in projects, and potentially later as interns as well. So they are getting to meet this interesting cohort of individuals. Next slide, please. So these are the main core courses. So every student to complete the master's will have to do each one of these courses. So the courses in green, number 1 and number 6, there are e-learning courses. The first one is to give you kind of the fundamentals, the basics of implementation and behavioural science. So if it's very, very new to you, you'll get this overview. We'll go through the theories of behavioural science and implementation science, the relevant frameworks, because there are so many. We won't do all of them, but we'll introduce you to the frameworks and how you can use them and why they would be used and what would be interesting potentially if you were later going to do a project as well. So that's the fundamentals. And then in the next semester, the e-learning, we go a little bit more advanced, we'll go through the intermediate, we'll talk about stakeholder engagement and things like that, and working on intervention. So that's the e-learning course. So that is all completely online. To complement the theories in the frameworks course, we have the research methods. So this is very research heavy, this is very methods heavy. We introduce you to study designs and explain that and apply how you can apply them in behavioural and implementation science. We go through frameworks. It's very practical. We have the students in workshops and we get them to go through practical examples, to work through examples. So they're sitting through it and actually applying the research and learning how to do it, rather than just sitting listening to us talk about it. It's more useful for them to practice through the sessions. So that's our research methods course. And then the program evaluation in health is for everyone, but it's useful for people who are interested in evaluating courses and evaluating different things, to understanding program evaluation in healthcare. And of course, you can use that in other places as well. And we talk about economic evaluation and other kind of evaluations there as well. And you learn the different process. So you learn the kind of the difference between program evaluation, research, and monitoring and implementing plans as well. The master's project then is our main dissertation project. So that's spread over 2 semesters. Master's 1 is where you kind of introduce your research proposal. We'll introduce you to supervisors. Some of you might already have supervisors that you're keen to work with. We are keen to work with different peoples around Singapore as well. So definitely connect with us and we can talk about that, about working on your supervised project. But we also have a lot of our in-house supervisors as well, who are very, very experienced in research, and they can work with you on your projects to help you develop projects that might be interesting, or they might have some of their own that are running as well. So some of our students are working on their projects and interested potentially in doing publishing papers, if they're interested in doing scoping reviews or different kind of papers like that. So the master's project 1 is in the first semester, and then in the second semester, you do an awful lot more analysis and you write up your project and you kind of develop that. And that is in the second semester. And the final one is policy, which it's running yesterday, Tuesdays, and that's with Professor Tiki, and I know Xiaoxuan will talk about that in a minute. And Professor Jason Yap, who are very experienced researchers and practitioners in the field of infectious diseases and in implementation and policy, and they'll take you through different case studies and talk about policy and how you can implement that as well. So I know for some people the titles mightn't be very, very clear, but they're all very, very connected. You're learning about implementation, how you can apply it. You're learning about behavioural sciences, how that can be used, and then in different domains like in healthcare, in hospitals, in the community, and also at the policy level as well. So there's all these different levels that we'll work through and discuss as well with our different experts. So they're the main core courses that all students will have to do. Then the students can choose 7. They have 7 elective courses, of which they can choose 3. So you can vary depending on your interests. The introductory research methods is a very introductory course for students who might need a bit of revision on their statistics and a revision on their qualitative methods. So we take you through those to kind of explain interviews and qualitative methods like ethnography, and go through some of your data, and just to kind of give you the basics for quantitative methods so you can use them then in the course. So that's at the start of the course. So you can do that before you start all of the other courses. The other ones then, Behavioural Decision Sciences, is run by our colleagues here, and this kind of gives you an overview of Behavioural Decision Sciences, which is a really nice course, and they talk about other things like simulations and everything else as well. So that's an elective. Some of our other colleagues, thankfully, in other areas like BMI and ISS, they run other courses for us, which are also very interesting, on digital agility and change leadership. And there, somebody has asked something about MBA. I think they work kind of more in that area, so they might be interesting for you. And also medical data and data processing for BMI, and advanced value healthcare. There are other colleagues who run those who are also very, very good courses, so you could choose those if you were interested as well. In the second semester then, we run a more advanced research methods course, which is more for people who are really interested in doing research. As I recommend to my students, if you're interested in doing a PhD, I would recommend that you do this, because it's useful if you want to work in complex interventions or hybrid designs or different kind of implementation designs, or work with kind of more complex hospital things that are going on as well. This can be very, very useful for you as well. So this is on our research track. So for people who are really more interested in research and probably less interested in practice, as Nick has described, the different kind of people interested interested in implementation science, the people who are more interested in practice and working in the hospitals or the community and applying it and actually using it rather than the less research side, we recommend that you do the advanced applications of behavioural, and that's a different course where you'll talk more about the applications. Xuan can talk a little bit about that if you have more questions, and that's kind of more for the application of it working in the practical area. So it's also very interesting. We have no exams, so we kind of do most of it by continuous assessment and participating in class and workshops, because we really want you to apply and learn the knowledge and work with the different course leads that you meet and the different lecturers that you meet. Next slide, please. So track specialization, as I've kind of hinted, this is not an obligation. You don't have to do this. This is a suggestion. And we will have Nick is our academic advisor at the moment, and other personal tutors, and Xuan and Jen are very helpful as well. So if you are kind of going, I don't know which one I should do connect with us and we can kind of give you advice on your different electives. If you are very interested in research, we recommend that you do the behavioural decision sciences and the research methods. If you are more interested in the practice track, maybe you should consider the other ones. But there's flexibility. It doesn't mean that you can't do research later on if you don't do those courses, but it would be useful for you if you are doing a PhD, for example, to do the research one. So these are just examples of those for the track specialisation. And then, so these are examples for students who are going to do full-time. So generally the students who are doing full-time will do 5, potentially 6 courses in semester 1 and then do 5 courses in semester 2. The reason I say 6 in semester 1 is because the elective introductory research methods is in the first week or 2 in the course. So you will have that finished. It's a kind of a more intense course. So you would have that finished and then you would have time to do the other 5 courses. So you have to obviously do the 4 core courses, and then you can choose one of the electives or 2 if you chose to do introductory research methods. And then in the next semester, you have to do 3 core courses, and then you can choose 1 or 2 of the electives. So that's kind of for more the full-timers. And as we said, you can do that in 1 year, or you can extend it if you want to another 1.5 years or 2 years as well. So you have up to 2 years if you want to, if that suits you. And then for the part-timers, some of them have kind of done this in a slightly different approach. If you are going to do a part-time, you have to do at least, Jen can correct me on this, you have to do at least 1 course per semester. But some of our students have done 2, some have done 3. So it depends on the student and your time. I suppose you have to review that. But again, we can advise and help you which one can be more resource heavy or intensive or whatever for you as well. But we recommend that you do the 2 core courses first, and then you can choose program evaluation, or you can do it in the following year. And if you were, as I said, a little bit rusty on your stats or very new to stats, we would strongly recommend that you do the introductory research methods. And then in the following semester, we have the policy one that, as I said, that's with Professor Tiki. And then you can do the e-learning, which is the following stage for the fundamentals. It's the intermediate stage of the theories and the frameworks around behavioural and implementation science. And then you could consider starting your master's project, where we'd connect you with your supervisor. We get you set up on ethics if that's the kind of project you're going to do, and get you ready to work through your dissertation. And then for the following year, then this is if you were going to do it part-time over 2 years, you could do your master's project you could do it in semester 1, or if you liked, you could push it back to year 2 if you wanted to have a break, or you wanted to work on your own time. There's a bit of flexibility there as well. And then the program evaluation, you would need to do that in semester 1 if you didn't do it in the previous semester 1, because otherwise you'd have to continue your part-time for a little bit longer, and then you can choose 1 or 2 electives, and then in the following semester then you can choose your electives. So there's flexibility. So again, Jen is around, I'm around, we can advise on that as you're going and as you do, and this is what students are doing with us at the moment, most of them have chosen their electives. And I think that's it. So let us know if you have any other questions. I'll pass you on to Xuan, who's very experienced and knowledgeable about all this. Thanks, Xuan.
Yeah, so thank you, Eva, for just going over all the different things about if you were going to do the master's completely straight up. So for those of you who are actually a little bit more tentative about wanting to sign up, or do not have the time to do it full time, so we do offer executive and graduate certificates for you. So currently we do offer 6 executive certificates. These are actually the same modules that you would do as for your master's, and these are stackable. What we mean by this is that each If you so decide to take one or two of these modules first, and then after which you decide to take out the masters, these modules would have been recognized already. So you do not have to retake them again. This gives you an opportunity, especially for those who are much more who have less time and they may not even be able to do it part-time, to at least actually start on your master's early, or at least to have a better feel of how the curriculum and the instructors are before you jump in full-time. So we do encourage you to take these. Most of these are actually mainly our core courses anyway, so you would have had to take them in the master's. So I'll just give you a minute or two just to look at the different certificates, but just to share that these are, Eva already has explained what these courses are. So I'll give you a minute just to look at, and if there are any other questions, just put it in the Q&A. Okay, next slide, please. So on top of having your the executive certificates, we've also recognized that some of you want specific certifications, which then allow you to then again, which are again stackable, but also we give a separate certificate to recognize that you have already covered a certain amount of work within the masters, and should be able to, and this would probably help to recognize that you are at least somewhat versed within the areas of behavioral and implementation science. So we do offer two graduate certificates, of course. The first one would be within the fundamentals of behavioral implementation science, which would cover both the fundamentals, more the theories, 5001, which is really about the fundamentals and the theories underpinning the masters. To the evidence-based in practice and policies, because you do need to figure out how these would actually apply into policy. And the third one is actually on the introductory research methods. So this sort of like gives you a fundamental foundation for you to then continue on if you seek to pursue more education within this area. Presumably, after you finish the first one and you still want to continue, there would be the intermediate level graduate certificate, which also involves mainly the intermediate level courses modules that we actually offer currently. So these are also something that we can encourage, especially those of you who may not thinking of doing a full load of coursework, to actually consider this as well. In terms of the fees and pricing, Jen will actually share that later. We always get a lot of questions. Okay, it's quite a niche master's per se. What are the areas of which we can actually get employment? So we did actually consult with different employers, including the hospitals, some of the research organizations, civil servants, and some of the other non-governmental organizations, including foundations and social service, and also consultancies. So this is what they told us. Firstly, this is mainly more from the healthcare organizations. It's really project management and healthcare. Understanding of behavioral implementation science would put you in good stead to actually help to implement, especially new healthcare programs, both in the public and private sector. Okay, apart from that, anything related to the population health, which is currently a growing emphasis within Singapore and in the rest of the world as well. Research, especially in the areas of health services research, public health research, and other things. Policy advisors, policy consultants, these are some of the things that also would be. And those who need to implement, of course, behavioral economists, and organizational scientists or administrators who are involved in operations or strategy are all areas that you can potentially get employment with in the future. Next slide, please. So underpinning all this is that we have faculty who are representative of the different areas that you had just seen, and also who are able to share a lot of experience and knowledge about the different fields that they have. So three of the faculty who actually were heavily involved with the setup and the design of the curriculum is our academic director, Prof. Nick Sabdalis, who was academic, has also been from Yong Lulin, but has also been working alongside healthcare workers, healthcare organizations for many years. And so therefore, in terms of the applications of that within the healthcare space, is someone that's very knowledgeable about how these methodologies apply within the health and public sectors. Prof. Robin Milden, who is also someone who has a lot of extensive consulting experience, and how do you actually apply implementation science within other within areas of health, areas of early childhood development and education, and also social services. So she comes more from both a research and as a consulting background, and so she also lends not just an academic lens, but also a practical lens in some of the things that she talks about. Prof. Joanne Yong, as you have introduced herself, and she lends both in the academic field and also as a research consultant field. So hence the curriculum ends up with these faculty, the curriculum basically ends up being both a combination of rigorous research, but as well as pragmatic considerations of how do you actually apply some of these methodologies across. Next slide, please. So supporting all this, a lot of the other faculty that you will see as we continue to deliver. So and as you can see, all of them also have varied backgrounds. So Dr. Eva Kofe, Kyo Hein, our program director, actually also hails from King's College, but has initially more of a basic neuroscience background, which then lends itself a different perspective before coming into implementation science. And that also provides an area of how all the different ways that we can actually apply the methodologies in different areas. Celeste is a research fellow with us, but with extensive consulting experience in applications of how do you apply health behaviors within policy and the application of that. Eugene hits the behavioral decision sciences course, and he looks at a lot of the applications of how do you apply behavioral interventions and also decision sciences into the different areas of healthcare. Gayatri is both a consultant and adjunct faculty from Canada, who also looks at how the applications of implementation science, especially in healthcare, but particularly in the allied health area as well. And Serene, who's another adjunct faculty with us, is the country head for a consulting group on behavioral insights in Singapore, and has extensive training experience in both the public and private sector. Okay. Next slide, please. So we can just keep going on about how each of the different faculty also apply. So Prof. Tiki is a visiting professor of us who actually spends an extensive amount of time with WHO as well. And so again, in terms of actually the applications of how the faculty and so lends a unique insight into how research can actually drive policy both on the national and the international level as well. Jason is an extremely experienced clinician who has also been heavily involved in both the running of public healthcare centers as well as how policies can be affected by this. So both of them hit our courses on policy, and so therefore and lend a lot of pragmatic insight apart from methodological expertise. Prof. Aneta Sinha is a health sociologist from the Department of Faculty and Social Sciences, and teaches how to actually do qualitative methods within health. And Prof. Siu Pang is also a very experienced healthcare researcher who looks at how to apply quantitative methods into this space as well. And yeah, so myself, I do learn I do try to tie some of these things into how you can apply these methodologies within your actual pragmatic work as well. Okay. Okay. Next slide, please. Yes. So there are a few other more adjunct lecturers as well who are part of this and will actually contribute. So many of these guest lecturers either give supervise students or provide case study or help to provide case studies, which then again add to the additional amounts of which add additional flavor to how the curriculum is set up, and also to breathe life into the examples on how you actually apply theory into practice. So Carrie, Wenxin, Hongchun, Sean are all very experienced and embedded researchers out in the they work either with their work together with us or are our frequent collaborators, and so provide a lot of and provide a lot of knowledge. They also tend to be some of the supervisors that we have, which would then allow you to then explore how different organizations are within your projects as well. Okay. Prof. Lee is also an example of some of the senior leaders that sometimes we will bring in to provide case studies and also the guest lecture on specific areas. These are very typically the senior leadership of different hospitals or different healthcare organizations, current or previous ones, which then again lend a slightly different lens of how our methodologies and our theories and frameworks actually impact health in general. So I'll go ahead and hand the time over to Jen now, who will then take you through the rest of the administrative areas of the program.
Hi, hello everyone. Good evening. Thanks for coming to today's info session. So my name is Jen. I am the program manager for this master degree program. So I handle a lot of the admissions, administration, and course-related student-facing work that's involved in this program. So my role here tonight is to share with you what are the admission requirements, the course fees, any tuition subsidies that are available for Singaporeans and US alumni. So I'll start off by sharing with you the admission requirements. So as you've heard so far, maybe you've already picked up the fact that our degree is actually quite focused on human psychology, human behavior, influencing people to make better changes and choices for themselves. So if you come from a background of psychology or social work and social science, it will be beneficial for your application into our master degree program. And also because of the fact that we are housed in a medical school and everything that we will come across, the case examples, the project work that you'll come across are all based within the sector of healthcare. If you have any experience or degree that you used to take, whether it's an undergraduate or a previous master degree or any kind of executive certificate programs they've done that is related to healthcare or life sciences or biology or cell biology, it will also put you at an advantageous position when you apply to our master degree program. So in summary, you can see on the slide that if you have a degree program in health, healthcare, psychology, social science, and social work or related fields to these, you will be beneficial when you apply. We also are looking forward to receive applications from people who are working in the healthcare sector. So whether you're a nurse, you're a practitioner, you're a pharmacist, you're a allied health professional, or you wish to venture into the sector of healthcare, then certainly please do consider our program, see it as something that would benefit your future career goals. And as you may have heard from all of my colleagues and directors before me, that our program is actually quite, in a way, a management level program. So it prepares you to design changes based on data and evidence that you see, that you found out within the area of interest. So we would value applicants who are coming to us with some level of work experience. So for example, if you have worked in healthcare or related field for at least 1 year, that will definitely put you or make your application stand out more against people who does not have that. And or if not, you've done internship programs before, or you've been attached to a certain hospital or department within the healthcare sector, then that also, please put that clearly forward in your application, and we will also evaluate that on a case-by-case basis. I see from today's attendance list that most of the people here are local Singaporeans, or you are residing in Singapore. So I don't think the language criteria applies here, but nevertheless, if your basic degree was from a university where the main medium of instruction was not English, then you need to fulfill the English test requirement, which is TOEFL 85 or IELTS 6.0. This is standard across School of Medicine master degree taught programs. But of course, if your scores are way higher than this, then definitely your application will stand out even more to us. This is not a requirement by us, it's a requirement by university, but certainly a lot of the discussions will happen during class, so it requires you to have that language ability so you can communicate and express your thoughts and be engaged in classroom discussions with your peers and your tutors. And lastly, we do require every submission to be accompanied by a personal statement. So what do you put in your personal statement? Basically, you tell us a story, or you try and convince us, why do you think you want to take this master degree program? How does it fit into your future career plans, or what you want to do for the future, or what inspired you to come and do a degree program with us in behavioral implementation science? How do you think that's going to benefit in your future goals in life? And also, we want to see a CV from you as well. Like I said before, work experience is beneficial for this application. Hence, if you have any work experience or internship experience, please put it down into a CV, and we'll take all of that into consideration. On top of that, we do require referees. So, but it's not too much. We just ask for at least one reference to be submitted with every application. Of course, if you have more, then please feel free to go ahead and submit them. But the minimum requirement is just one referee. So the additional documents that you need to submit along with the application form is a personal statement convincing us why do you want to do this program, how is it going to benefit you, 2, your CV, and 3, a reference letter from a referee of certain professional standing. Next slide, please. So other than all of that important information, other very important information is what is the course fee. So our course fee for August of 2025 intake is $56,700 before GST. If you put on the additional 9% GST that we don't make and it goes back to the Singapore government, it will be $61,803. Very, very, very good news. If you're a Singaporean or PR, the NUS has generously offered all of Singapore people living in Singapore, or rather you're Singaporean or PRs, a whopping 40% discount on next year's tuition fee. And this tuition fee is valid for August 2025 intake and August 2026 intake. Whether you will extend beyond the 2 years, I am not sure at this point, but I know next year if you're applying, you will enjoy the 40%. So do your mental calculation or pull out a calculator, and then you can work out how much is that going to cost you. If you are an NUS alumni but not a Singaporean or a PR, then you enjoy 20% discount, which is also not too bad. But if you don't fall within any of these 2 categories, then I'm so sorry, you will pay the full fees, but we will love you very much. Okay, so on top of the tuition fee, there's an application fee of $50 that the system will charge you. $50 does not include GST. And upon reviewing of your application, we're very happy to have you come and join us. We will make an offer to you through the system. If you accept the offer, you will have to pay upfront at the point of accepting the offer a $5,000 acceptance fee, which is deductible from the overall cost fee. The application fee is not deductible, but the $5,000 is deductible. So it will be offset from your first tuition fee payment. And in terms of how do you pay your tuition fee, so that depends on whether you're applying to be a full-time student or a part-time student. A full-time student's normal candidature is 1 year, maximum 2 years. A part-time student's normal candidature is 2 years, maximum 4 years. So for example, I think based on today's audience profile, maybe people here are thinking about doing it part-time. So looking at a 2-year minimum candidature. So the master degree course fee is charged on a semester basis, and semester 1 is always in August of every year, and semester 2 is in January of every year. So you will have to pay your tuition fee by semester, meaning if you're taking 2 years to complete, that is a total of 4 semesters. So you take whatever amount that you're supposed to pay after the 40% or 20% rebate, you take that minus $5,000, divide by 4. That's how much you will pay every year in August and January. And it will take 2 years, meaning the university will charge you 4 times to finish that amount. It's regardless, the payment schedule is the same regardless how long you actually take to finish the master degree program. So if you're a full-time student, then you divide that number by 2, and that's how much you will pay in August and then subsequently in January over 2 payment schedules in that sense. And that's also regardless of how long you actually take to finish the master degree program. So if there are any questions about that, you can ask me when we go into Q&A. In terms of application deadline, application has been open since December. International students, your application deadline ends slightly earlier on the 30th of April. And for local students, we will close the application on 31st of May. But all of these dates are tentative, and we may extend it depending on the outcome of the applications that we receive. We may choose to extend the deadlines. Next slide, please. Shao shared with you that we have certificate options for our master degree, which means that you don't have to commit to the full master degree all in one go. You can take them in sort of bite sizes depending on how committed you feel you want to be on the program. So you can do them in individual courses or modules, and if you do them one module at a time, there are a total option of 6 of them. Each one of this module or certificate is going to cost you $6,489.32. And if you choose to take the modules or courses in buckets of 3, and they are graduate certificate options, then you just multiply that number by 3, and you're looking at $19,467.95, inclusive of GST. I do have to mention at this point that the course fee for certificate programs are charged at a 5% premium over the overall master degree. So meaning if you buy in bulk, it's always cheaper than if you buy in smaller quantities. So same logic. If you do your courses, it's 5% more expensive than if you do the whole master degree at one go. Okay, and on top of that, the 20% or 40% university rebate does not apply to the certificate program. But I do believe that if you eventually decide that you want to do the master degree program, then at that point when you eventually decide, the rebate, whatever the percentage rebate is, will then be calculated into the remainder of your course fees and be offset to your subsequent payments. So that's all for this slide. What's next? Okay, so next is very exciting. We have a special guest speaker tonight who has kindly joined us, and she is one of our current batch of master degree students. And so she's already completed the first semester with us, and she's in her second semester. Her name is Miss Xiaomeng. She's an excellent student, and she has agreed to come and share with the audience tonight her experience on our master degree program, what made her want to do our program, how she feels so far, and where does she see herself going next. So Xiaomeng, please.
Thank you, Jen, and hello everyone. My name is Xiaomeng, and I am currently a full-time master's student in the BC program. It's a pleasure to be here today to share my experience with you, and I hope my insights will be helpful as you consider this program. So let me start with a brief introduction about myself. I completed my undergraduate studies in health science in Germany, where I was introduced to some concepts in behavioral science. When I decided to further explore this field, I was thrilled to discover that NUS had launched the BC program. What excited me most was the program's comprehensive curriculum, which is designed to enhance both academic and practical skills. For instance, you'll learn qualitative and quantitative research methods, how to conduct systematic reviews, and how to design complex interventions. And if you're aiming to become a researcher, I believe this course will provide an excellent foundation. On the other hand, if your goal is to apply knowledge in practical settings, the program also offers a practical track where you can develop, for instance, data-related skills and more. So it's a well-rounded program that I am sure will inspire you regardless of your focus. And from my personal experience, studying at the postgraduate level is very different from undergraduate studies in Germany. Graduate programs require much more personal initiative. The knowledge you gain depends significantly on your own effort and ability to manage your learning. That said, I want to assure those of you who may not have a healthcare background, don't worry. Many of my classmates come from diverse fields such as psychology, social science, and business. And in the early weeks of the program, there are introductory courses to familiarize you with the field and guide you in starting healthcare research. And as long as you're really interested and willing to dedicate time and effort, you'll adapt and thrive. Moreover, our professors and lecturers are very supportive. You can ask questions during classes, via email, or in one-on-one meetings anytime. Another point I'd like to mention is the program's blended learning format. Full-time and part-time students attend classes together, which means we do have evening classes. Additionally, some sessions are taught by external or international lecturers and may be conducted online, so adaptability is key. However, most classes are conducted in person. And in terms of workload, my experience has been that the first half of the semester one, up until the reading week, is relatively manageable. During this time, you are still acclimating to the program, getting to know your peers and understanding the discipline. You have time to participate in many NUS activities and also for foreigners to explore Singapore. And however, the workload intensifies in the second half of the semester with more assignments and increasing difficulty. At the same time, you'll start preparing for final assessments. While we don't have traditional written exams, we do have group projects, presentations, and nearly every course requires a final essay. So the last few weeks of the semester can get very busy. So time management is essential. As for our plans after graduation, we all have different goals. As I mentioned earlier, if you want to pursue a career in academia and become an excellent researcher, this program will support you greatly. In fact, many of our peers are planning to continue on to PhD programs. And additionally, some of our classmates come from clinical backgrounds such as surgeons, clinicians, and pharmacists. They recognize the growing need for expertise in implementation science, which lead them to choose this program to enhance their professional skills. So the beauty of implementation science lies in its focus on accelerating the application of evidence-based practice in real-world settings. This challenge exists across various sectors, so knowledge and skills you acquire in this program have broad applications. Ultimately, it depends on your personal interests and career goals. What I'd like to emphasize is the wealth of resources available at NUS. For example, we have career fairs where you can connect with professionals from diverse industries and organizations. Additionally, there are plenty of workshops and industry conferences where you have opportunities to engage with experts from academia. I remember we have a 3-day academic conference coming up in February. And as students, we can attend for free with the school covering the costs. So if you are unsure about your future path, I encourage you to take advantage of these opportunities and resources, attend workshops, try different things, and explore areas that interest you. This is the time to discover what truly resonates with you and pursue it. So that's my experience so far. If you're curious about student life in our program and have any questions, feel free to ask. Thank you.
Thank you, Xiaomeng. Before I move on to the Q&A segment, here are some QR codes that you can scan if you're interested. The first one will link to our BZ website, and the second one should link to the application portal. Yeah. And then maybe I'll give you some time in case you want to scan it. Then the next two QR codes are links to our social media accounts. So the first one will be LinkedIn and second will be X, also known as Twitter. With that, we have come to the end of today's session. So as mentioned earlier, if you have any other queries, do email us at busylearning@nus.edu.sg. I've already put the address down in the chat box. So once again, a huge thank you to everyone for coming, and we hope to see you in class.